It is 9:30. We'll go ahead and get started for today. Thank you everybody for joining us here this morning. I will continue to let people in as we get logged in this morning. But my name is Lori Smith. I am the training coordinator here with Direction Home, Akron-Canton Area Agency on Aging and Disabilities. If you will indulge me for just a few moments, first I'd like to run through just a few Zoom controls that we'll want to keep in mind this morning. I will ask that everybody remains muted, and just to make sure you are muted, I'll keep my eyes on that as well. And that's just to keep background sounds and distractions down to a minimum. But because we are muted, I will also ask you to open your chat window, and that's where we can ask questions and make comments. To do that on your computer or laptop, you should see a strip of menu options. It might be at the bottom or top of your screen. But somewhere about midway across, you should see something that looks like a little thought bubble. It says chat underneath it. If you'll go ahead and just click that, it will open a chat window to the side of your screen. And again, that's where you can type any questions you might have, and we will collect those and share them with Francine at the end of the presentation. You can type a message to everyone here, and that is how I will ask that you answer your questions. Just make sure as you've got that chat window open that it does say to everyone. If you would like to send a message to one person in particular, you can click that little down arrow by where it says everyone. Choose the person that you want to send that message to, and then that will only go to that person. I won't see it and Francine won't see it. So if it's a question, make sure that we are able to see it by making sure that everyone is displayed. You can see myself, Francine, and hi Lynette. We are sharing our webcams. We do encourage you to do that if you are comfortable with it. I think it makes things feel a little more interactive and more personal, but by no means are you required to do that. If you would like to, again, in that strip of menu options, you will see something that says either start or stop video. And when you click that, there's a couple more people joining us. We would love, again, to see your faces. But again, if you choose to do that, just be mindful of what's going on in the background, maybe what you are doing. Sometimes a lot of movement can be distracting for folks as well. So if you need to stand up and stretch or step away from your computer for a moment, feel free, but just make sure you've got that webcam off. Then this is fun. I'm seeing people pop up now on their webcams. This is fun. Couple other things to keep in mind. If this portion of your slides on your screen is a little bit too small than you would prefer, you can change that. If you put your cursor between the slides and whatever is showing to the right, it might be us, it might be that chat window, but if you put your cursor between the slides and whatever that panel is to the right, your cursor will change into a double-sided left-right arrow. And then by holding your left mouse button down, you can drag those panels left to right and adjust the size if you would like. I think that is all I've got for Zoom at the moment. If you'll just give me a couple more minutes of your time, I would like to really share with you a little bit more about what Direction Home is as an area agency on aging. I know you all come to these seminars and of course you appreciate that information, but we do have so much more that we can offer that might help you or a loved one, family member. And I'm just going to go through these things very quickly before we move on to the star of our show, Francine. So as you can see here, our mission at Direction Home Area Agency on Aging is we want to provide older adults, people with disabilities, and their caregivers long-term care choices and consumer protections so that they can achieve the highest quality of life. And what that really means in a nutshell is that we provide choices for people to live independently in the place that they want to call home, whether that is their home in their neighborhood, in the community, or if they choose to go to a long-term care facility. I will take a moment here to share that we are just one of 12 area agencies on aging in Ohio. Our coverage area is Stark, Summit, Portage, and Wayne counties. If you or a loved one is outside of those 4 counties and you are looking for assistance, there is an area agency in Ohio and really nationwide. We are a nationwide network that can help you get those services to, again, stay living in the place that you want to call home. But who we are at Direction Home, our staff is almost 250 large, and we are comprised of social workers, registered nurses, state certified long-term care ombudsman, We've got a dietitian on our staff, and then those other business professionals like our IT staff and our HR, those people that are kind of behind the scenes that keep us rolling day to day. The first time you contact an area agency on aging, whether that's us or one of the other ones nationwide, most likely you will be connecting with the Aging and Disability Resource Center, and you may see that abbreviated ADRC. And what that really is, it's a one-stop resource for questions on long-term care, and they can answer any question you might have. So a few questions that they can help with are what community and government programs might be available to help in your area, how to get help so you or your loved one can continue living in the community as long as you would like, where to get home delivered meals if that is something you are looking for, what senior housing might be available in that local area, how to reduce stress from caregiving. We have a fantastic family caregiver program, and where to turn for support with a loved one who is experiencing Alzheimer's disease. They can answer a lot more questions than that. That's just kind of a brief overview. So if you have any question about yourself, about a loved one, please do give us a call. It is free to connect with them, and they can give you all kinds of resources. The next step, again, if you would like, after connecting with that ADRC representative, is you can receive a free in-home assessment. Those assessments are open to everyone who might be interested in our long-term care services, and it is completed by a registered nurse. During COVID, we did do them telephonically. We are starting to do them back in the home again, and that really allows for a more thorough assessment. And what that does then is it determines eligibility for programs offered by Direction Home. And if we find that you're not eligible for one of our programs that we offer, we're not just going to dust our hands off and wish you luck back in the world. That nurse will develop a community care plan and link you to community supports that can get you the service and supports that you are looking for. I mentioned a bit ago that we do have a fantastic family caregiver program, and this is that. We provide family caregivers support. And when I say family caregivers, I mean those non-professional caregivers. So you may be in that situation yourself where you might still be working and you're also helping to take care of your aging parent, getting them to and from doctor's appointments or with their finances or chores around the house, something like that. That is not what you do as your paid profession. And we understand that, of course, you do it because that person is somebody that you love dearly and you want to help them out, but it can come with a lot of stress, and we realize that. So we can offer respite education and reimbursements for some of those services you provide, supplemental materials, referrals to support groups. Direction Home actually has a really great family caregiver support group ourselves. And then we do also offer speaking engagements on caregivers, stress, and burnout. We have a class that touches on that as well, and I'll get to that in a second. The bulk of the programs that Direction Home has are Medicaid programs, and I'll go through these very quickly. A lot of people think when they hear Area Agency on Aging that it is just for that older population, and as we go through these, you'll see that is not the case. I think the program that most people are familiar with is our Passport program, and that is available to folks 60 and older. We also have an assisted living waiver, and that is for people 21 and older. So again, you can see we don't just work with the aging population. It really is birth through end of life. We have the Ohio Home Care Waiver, which is available for people 59 and younger. And then Mycare Ohio is for folks 18 and older, and it is specifically for those dual eligible folks who qualify for both Medicaid and Medicare. And if you have any questions, again, I'm just going through these quickly so we can get to the Medicare information, but any questions about these, please do contact our ADRC at that Aging and Disability Resource Center. We have a long-term care ombudsman department, of which Francine is a part of. And what they are, they're where you go if you have a complaint or a concern with your long-term care facility or in-home care. They are consumer advocates. They really go to bat for our consumers. And they are also where you can find long-term care selection assistance. If you have any questions about the facilities that are out there, services they offer, costs involved, you can reach out to them and they can walk you through that process. They are the department where you would go to, again, resolve that complaint with nursing home care. And they have rights-based information in both rules and practices. And again, they advocate so much for those consumers. They follow the directives of that consumer, and they've got their back. We offer evidence-based education, and that is part of what I do. So if you have any questions on this, please let me know. They are free workshops available throughout our 4 county communities. And they are designed to help older adults who might be concerned with falls, the frequency of falls they have, or if they're dealing with a chronic condition, or again, if you are a family caregiver. We do have 2 falls prevention workshops. The first one is Matter of Balance. It is an 8-week program in which we talk about being aware of your environment, how to be assertive with your needs, not aggressive. We don't want anybody launching themselves over a table and yelling at people, but how to be assertive in what you need, building clear, concise communications with your healthcare team so you can get stronger and reduce the incidence of falls. It does offer some exercise elements, and they are just small movements that really can increase your strength and balance and flexibility. But the overall focus is on sitting down, doing idea shares, and building that awareness. The second of our falls prevention workshops is Taiji Shwan, Moving for Better Balance, and it is solely movement-based. Over the course of 24 weeks, we learn 8 forms based on Yang-style Tai Chi. Those forms have been modified specifically for adults who feel they have a higher risk for falls. But again, throughout the course of those 24 weeks, you will see your strength improve, your balance improve, and your flexibility improve. We have a 6-week class revolving around chronic disease self-management. So if you are dealing with any type of chronic condition, something that is just now lifelong, it's not something that can be cured. We talk about ways to reduce stress. Again, having that good communication between your healthcare team and your family, any supports that you might have, how to improve nutrition and physical activity and sleep, and all of those things that will help you to better manage whatever symptoms you're having with the chronic condition that you are experiencing. And then we have another one that drills that same information or same techniques down to diabetes. We talk mostly about type 2. We do touch on type 1, but we really focus on diabetes self-management. And then finally, Powerful Tools for Caregivers is that class specifically for those unpaid family caregivers, again, talking about reducing stress, how to have that communication between you and the person you're caring for, and your family members who might be helping you to care for that person. All revolving on how to allow you to be the best person you can be so you can be the best caregiver you can be. This is where you can reach out directly to us. That 800 number goes straight to our Aging and Disability Resource Center. And though it is an 800 number, it does go locally to our office that I am sitting in right now. We've got some great representatives that work their darndest to pick up that phone every time it rings. If by any chance you do have to leave a message, they will get back to you very quickly. Again, it is a free service and they can answer a wealth of questions. So please don't hesitate to call them with any questions you might have. And then there is our website address too. I encourage you to jot that down, visit it and see a little bit more of what our services entail, a little bit more in depth. There's some other contact information there. And again, if you have any questions, you can go to either one of those places. As we move into our seminar, I will also put my information, my contact information in, as well as Francine's. So if you have any questions about those classes that I mentioned, or with Medicare, you can reach out to either one of us as well. And with that said, I will turn it over to the star of the show, Francine. Thank you for doing this yet again. We appreciate you.
Thank you, Lori, and good morning to everyone. As Lori said, I am a long-term care ombudsman. I am the Director of Entitlement Rights here at Direction Home, and I've been an ombudsman and Medicare specialist for the last 20 years. And as you can see from the information that Lori provided, we are here to serve. including this seminar today. So with no further ado, we will begin our PowerPoint. So Medicare. Medicare actually is national health insurance. It is for people over the age of 65 and over, or those who have been disabled through the Social Security Administration for 24 months. Enrollment begins 3 months before your 65th birthday and extends up to 3 months after your 65th birthday. So you have 7 months to enroll. It's good to enroll prior to your 65th birthday because that way your coverage will begin the first month you turn 65. There are a couple of ways you can enroll in Medicare. The first is by going to the Medicare website, which is www.medicare.gov, or you can call or visit your Social Security Administration. If you happen to miss Medicare enrollment, you can enroll between January and March of each year, but your coverage will not begin until July 1st of that year. Next slide. There are some special enrollment times. If somebody is in a Medicare Advantage plan, which we'll talk about later, and they move out of their county or they move out of state, they will have a special enrollment period. When you move in and out of a nursing home, you have a special enrollment period. Or if you lose primary coverage through an employer, or if for some reason you lose coverage through a Medicare Advantage plan. In addition to that, if you're provided inaccurate information by a salesperson and you can show that that is so, you may be given a special enrollment time. And if each year between January 1st and March 31st, a person can change from their Medicare Advantage plan to another Medicare Advantage plan. So if you decided you made the wrong choice in Medicare Advantage plans, you can switch. Or you can switch from your Medicare Advantage plan to original Medicare. What you cannot do during that time period is switch from original Medicare to Medicare Advantage. So most of you are likely already on Medicare. So now's the time for you to check your coverage. And this is a very important time. Everybody should check their coverage during this time period. And as we go through the PowerPoint, you will see why. If you were in a Medicare Advantage plan this year, so if you were in a plan like Anthem Senior Advantage or Mycare or Prime Time, you should have gotten what's called an annual notice of change, which told you how your current plan is going to change for 2022. Now, these changes can also be online, so you may have to go to the plan's website to read about that. So each year we do these seminars because changing your coverage can happen between October 15th and November 7th. So any changes you want to make this year, you need to do by midnight on December 7th. And this includes all Medicare beneficiaries, including those who also have Medicaid. Now, when thinking about Medicare, people often tell me it's so complicated, and to some degree it is, but let's try and simplify it. You have two coverage choices under Medicare. You can either choose to be on traditional Medicare, or you can choose to be on a Medicare Advantage plan. And there are advantages and disadvantages to each selection. To be on a Medicare Advantage plan, you have to also be enrolled in Medicare Part B. These are private plans that contract with Medicare. They are not supplemental plans. It's just another form of Medicare. Supplemental plans are something quite different, which we will get to. Most of the Medicare Advantage plans include drug coverage. They have to cover the same services as traditional Medicare, but they also can cover extra benefits like vision care or dental care. In addition, they have out-of-pocket limits. However, they do have geographic restrictions. So Medicare Advantage plans differ from county to county. And there are provider restrictions, meaning that generally speaking, Most Medicare Advantage plans require you to use their doctors, their hospitals, and their other providers. In traditional Medicare, there are no extra benefits like vision or dental, to date anyhow. There is movement in Congress to try and add these benefits. There are no out-of-pocket limits. There are, as we are going to see shortly, co-pays or out-of-pocket costs that you're going to incur, but you can get these covered if you purchase a supplemental plan. With traditional Medicare, you have to also add a prescription drug plan, which we call standalone Part D plans. However, there are no geographic restrictions and there's no gatekeeper. So in Medicare Advantage plans, for many medical services, you have to get prior authorization. That is not the case in traditional Medicare. And in traditional Medicare, you can go to any provider in the United States that takes Medicare. So the choice is yours. You will see as we go through the PowerPoint when we talk about Medicare Advantage or Part C, some have premiums, some don't. Again, you have to have Part B. Many of them, actually, most of them actually include drug coverage. So you get your medical and your drug coverage wrapped into one. And you cannot buy any supplemental plans if you join a Medicare Advantage plan. With original Medicare, there's no premium for Part A. There is a premium for Part B. You have to add drug coverage and you can purchase a supplemental plan. So let's get to our out-of-pocket costs for traditional Medicare. Under traditional Medicare, we currently still do not have the changes for 20 and 22. So what you're viewing are numbers from this year. And as I mentioned, for most people, there's no premium for Part A, because if you or your spouse worked full-time for 10 years, you've already paid into the system for Part A. So you're not going to have a premium. There is, however, a deductible. Part A covers your hospital insurance. So when you go into the hospital, this year you would have incurred a deductible of $1,484. You can see that went up from 2020. We expect that to go up again in 2022. After you pay your deductible, you are then covered in full for hospitalization up through day 60. If you're in the hospital past 60 days, you will have a daily co-insurance amount. So for days 61 through 90, that co-insurance amount this year would have been $371. Again, that's expected to go up for 2022. Then if you happen to have a very serious illness, and this is very rare, and you're in the hospital for more than 90 days, you can use what's called lifetime reserve days. And that will cover you from days 90 run through 150, but there would be a co-insurance amount of $742 per day, which is quite steep. Again, we do expect increases for 2022. And I also want to mention that in addition to hospital insurance, Part A also covers intermittent skilled home care services, but a person has to be deemed homebound to receive those services. Original Medicare Part A also covers skilled nursing care. Now, skilled nursing care is not custodial care. So it's not just covering a person in a nursing home who just needs help with their activities of daily living, like dressing, eating, and bathing. Under traditional Medicare, until COVID, traditional Medicare required a 3-day hospital stay before they would cover skilled care in a nursing home. Skilled care in a nursing home is defined as physical therapy, occupational therapy, speech therapy, or daily monitoring needed by an RN, which you'd have to be very complicated medically to require. Now, during COVID, the 3-day hospital stay is no longer required. The 3-day hospital stay, when it was required, did not include observation status. Many people end up going to the hospital through the emergency room. They may think they may be in the hospital for 3 or 4 days. They may think they're admitted, but they're not. They're under observation status. However, there are rules now that say within a 24-hour time period, you should be notified by the hospital if you're under observation status. So if you end up going to a nursing home for skilled care, so let's say you get a knee replacement and you need physical therapy or occupational therapy or speech therapy, you have full coverage up to 20 days. After day 20, for days 21 through 100, you would have a copay this year of $185.50. Now, please realize that this benefit only lasts up to 100 days, and it's very difficult for people to remain skilled for that long. A new benefit can begin if a person is not in a hospital or a nursing home receiving skilled care for 60 days. Now, this can also be waived under COVID. However, it is up to the facility to decide if this is the case. Part A, in addition to hospital insurance and skilled care, covers hospice coverage. Hospice is comfort care. It is not curative treatment. It provides services for pain management and symptom relief. It includes drugs and durable medical equipment. It can include aid and homemaker services, spiritual and grief counseling. It does not cover room and board in a skilled nursing home. So the hospice services would be covered, but the room and board would not be covered. And if a person is receiving hospice services at home and the family needs a break and the caregivers need a break, you can get coverage for respite care in a facility, but there is a 5% copay. So Medicare Part B is your medical insurance. So we have Part A, which is generally hospital insurance and the other things we just covered. And then you have Part B, and everybody pays a premium for Part B. Typically for this last year, most people paid a premium of $148.50 per month. Again, we do not have the figures for 2022. They have not been released yet. However, from what I read, there should be an increase anywhere from $4 to $10 per month for the Medicare Part B premium. Most people are leaning towards that $10 a month, so we're kind of expecting that to increase to $158.50. In addition to having a premium, there is a yearly deductible. So at the beginning of each year, you would pay a deductible before your coverage kicks in. So this year you would have paid a deductible of $203. So when you go to the doctor or need other medical care covered under Part B in the beginning of the year, except for preventative services, which are covered in full, you would have had to pay the first $203 before your coverage kicked in. And then once your coverage kicks in under Part B, you are responsible for 20% of the Medicare approved amount. So Part B covers 80%, you would pay 20%. In addition to the premiums that I talked about, Part B is income adjusted. So if you are a single person making more than $88,000 a year, or if you are a married couple who makes more than $176,000 a year, your premium will be adjusted based on your income. So will be higher than those other individuals. There are certain people who can delay enrolling in Part B. So when you turn 65, or if you're disabled for 24 months, and you or your spouse have medical insurance with a current employer, and that medical insurance is considered primary to Medicare, you can delay enrollment into Part B. So why would you want to pay that premium if you already have medical coverage through your employer? To do this, you have to inform the Social Security Administration that you wish to delay. If, however, let's say you lost your insurance from your employer and you decided to take what's called COBRA. So you wanted to keep your employer insurance. Many times employers will allow this for up to 12 months. You still have to enroll in Part B within 8 months of accepting COBRA. Do not wait the 12 months till your COBRA coverage ends. You have to enroll within 8 months. If you do not enroll in Part B when you are first eligible, and you can't delay it for any reason, you will pay a late enrollment penalty, which is 10% of the premium for each month you were eligible and did not enroll. So that can be a pretty stiff penalty. So you don't want to miss your Part B enrollment. So as you can see, there are many out-of-pocket costs if you choose traditional Medicare as your coverage. To defray those costs, you can enroll in a Medigap or supplemental plan. These plans are standard private plans that cover out of cost with traditional Medicare. You cannot buy a supplemental plan if you are enrolled in a Medicare Advantage plan. Now, the monthly premiums for these plans will vary by who sells the plan. And in your packets, you should have received or will receive a chart that has a green, that at the top says Medigap or supplemental plans. And you will see that there are, I think, about 12 of these that you can choose from. However, Plan C, F, and high deductible F and high deductible Plan F have been discontinued for any new enrollees into Medicare after 2020. So if you were in Medicare during 2020 and before, you can get these plans. But if you were enrolled in Medicare beginning in 2021, you can no longer purchase these plans. Also, be aware that these plans do not cover prescriptions, long-term care, dental services, or vision care. They only cover services under traditional Medicare. And there are some guaranteed issuance rights with these plans. The best time to purchase a Medigap plan is when you first enroll into Medicare. You can get a Medigap plan. They cannot ask you about pre-existing conditions. So they cannot charge you more if you have a pre-existing condition. Also, if you are new to Medicare and you decide to join a Medicare Advantage plan, and then you decide, I don't like the Medicare Advantage plan, I wish I was in traditional Medicare, you have the right to purchase a Medigap plan as long as you do it within the first 12 months you joined Medicare. However, you can be asked about pre-existing conditions at that time. Next slide. For those individuals with lower incomes, more modest incomes, there is help for them to pay their Medicare Part B premiums, deductibles, and copays. There are 3 types of programs, QMB, SLMB, and QI. We have put in here the income limits and resource limits for these programs. And to enroll, you can either call our Aging Resource Center, or you can contact the Department of Job and Family Services. And there is an application you can fill out. And if you qualify, you can at least get your Part B premiums paid for. If not, all of your deductibles and copays. We're now going to turn to talking about a Medicare Part D or prescription drug coverage. These numbers are for 2022. So these numbers have been released for next year. What you see here is what we call the standard benefit. This is what plans have to do. So all of these plans can have an initial deductible of $480. They cannot have a deductible higher than $480. They can have a deductible lower than $480. Then the initial coverage limit for next year has been raised to $4,430. Now that includes the amount you pay at the pharmacy plus what the plan pays for your prescriptions. Once you reach that amount, you would fall into the coverage gap. And currently, the coverage gap during that time, your out-of-pocket costs are capped at 25% of the copay for your medications. Then if you have extremely high prescription drug costs and your out-of-pocket costs reach $7,050, you would then be eligible for catastrophic coverage. And at that time, you would either pay 5% of the total cost of your drug, or about $3.95 for generics, or $9.85 for brand name drugs, but not more than that. To get prescription drug coverage, you have two choices. If you join a Medicare Advantage plan that has prescription drug coverage, that's one way to get it. The other way, if you decide to be covered under traditional Medicare, you would have to join what we call a standalone Part D plan. In your packets, you will find a chart that has a green banner at the top, and that chart will list for you all of the standalone prescription drug plans in the state of Ohio, what their premiums are, what their deductibles are, and if they have enhanced coverage. Now, if you have coverage for your prescriptions through the VA, or you have creditable coverage through an employer, either through a current employer or a retirement plan, as long as that coverage is creditable under Medicare, meaning that it's better, it's the same as or better than coverage under Medicare, which typically they are, you do not have to join Part D. However, if you do not join Part D when you first become eligible, again, there is a lifetime penalty, and that penalty will be 1% of the average national premium for each month you did not enroll. The other thing to recall is you cannot join a prescription drug plan in the middle of the year. So oftentimes people that are new to Medicare will say, I don't take any prescriptions. Do I have to join Part D? Well, it's a good idea to join Part D when you first become eligible, because if you become ill during the course of the year, you can't get prescription drug coverage in the middle of the year. So it's like having homeowners insurance or car insurance. We don't wait till a catastrophe happens to get coverage, because then we won't be covered during that catastrophe. Same thing applies here. So in considering what coverage is best for you for your prescriptions, you need to make sure that all your drugs are covered by the plan's formulary. You also want to consider costs. So what are you going to pay for your prescriptions out of pocket? Payment for prescriptions out of pocket will vary significantly by plan. Sorry about that. Also, you want to look at it to see if there are any restrictions for your prescriptions. So does your prescription require prior authorization? If it does, you want to make sure that you get that before the beginning of the year. Are there quantity limits, or is there step therapy? And step therapy is when a plan requires you to take a cheaper drug before you take the more expensive version. If, for instance, you know that you've already tried cheaper versions of a particular medication and they have not worked, and you need the top of the line of that prescription, your doctor can do an appeal with that plan and tell them that you've already tried these other drugs and they did not work. And typically, you will then be able to get the drug that you need. You also want to look at pharmacy network. So you want to make sure that you're going to an in-network pharmacy. And all these plans have in-network pharmacies. So don't go to the drugstore and ask your pharmacist, hey, Mr. Pharmacist, do you take this plan? They probably take all the plans, but that doesn't mean that they're an in-network pharmacy. And if you go to an in-network pharmacy, you're going to pay less than you would if you are obtaining your prescriptions in an out-of-network pharmacy. So how do you determine all this? There's only one way to determine it. You need to do an analysis. And yes, every year I say the same thing. And yes, every year you should be doing an analysis. So you can do an analysis yourself or have a family member go to www.medicare.gov to assist you. You can call Medicare, or you can call the Ohio Senior Health Insurance Information Program. And so we have those numbers listed here for you. There are representatives there who are qualified to look at your drug costs. And what they will do is you will have to have a list of your prescriptions ready with the dosages and how many times a day you take them. They will put them into the Medicare website, and the Medicare website will magically determine which plans are most cost effective for you. And as I said, there can be extreme differences between costs of prescriptions in some plans. I did this for a friend of mine who takes a lot of prescriptions the other day. And in one Medicare Advantage plans typically come out to have cheaper costs than the standalone Part D plans, I've noticed. But for my friend's prescriptions in a Medicare Advantage plan, between the cheapest Medicare Advantage plan and the next tier, so the next few Medicare Advantage plans that covered his drugs, there was a difference of $3,000. So you want to be very careful, especially if you're taking a lot of medications. Just as there was for people on Part B, there's extra help for people who have prescription drug coverage, who have modest incomes. So here we show that you can qualify for some help with your prescriptions if your income is below $1,630 per month if you're single, and you have less than $14,090 in resources. If you're married, it's a little bit higher, $2,198 per month, resources below $29,250. There's full extra help and there's partial extra help. If the income falls into what we show here, you're getting the partial extra help. So if incomes are below what we show here, a person can get full extra help, which means they can get a prescription drug plan for $0 premium per month and have very low copays. So as long as people who qualify for this choose a plan with a premium of less than $33.54 a month, they can get that plan for $0 premium. However, if a plan is chosen with a premium higher than that amount, then they will pay the difference between the premium and the $33.54. To apply, again, you can contact us, and we have people in our Aging Resource Department who can help you apply, or you can go to the Social Security website, and there is an application for extra help with Part D. So we talked about traditional Medicare and what it covers. That is one choice for Medicare coverage. We talked about prescription drug coverage. Now we're going to talk about Medicare Advantage plans. As I mentioned, to join a Medicare Advantage plan, you must have Part B. Most include drug coverage, a few do not. If they do not, you have to choose a standalone Part D plan. So all of you in your packet should have received very colorful, pretty charts for the county that you live in that show all the Medicare Advantage plans in your county. And there are quite a few. You will see on those charts that we have listed the premiums, whether they cover prescriptions. And if you notice on the chart, if you go to the very last pages of those charts, there's like a page that has a lot of red on it. Those are the plans that don't include drug coverage. We also show if there's a prescription drug deductible in the plan, if you have doctor choice in the plan, and if there's what the out-of-pocket maximum is. So remember I said that with Medicare Advantage, there are out-of-pocket maximums. So if you look at the last column on those charts, you will see what that out-of-pocket maximum is. And what that means is once your out-of-pocket costs reach that amount, you are covered in full. So you will have no more out-of-pocket costs. So if you're a person who has a lot of medical expenses, you want to look very carefully and probably choose a plan that has a much lower out-of-pocket maximum. As I said, you will see some of these plans have 0 premiums. Medicare Advantage plans never require a 3-day hospital stay to get skilled care or rehab in a nursing home. So even though traditional Medicare is not doing that now during COVID, typically it does, but Medicare Advantage never does. You must also note that there are provider limitations. They often apply. So anytime when you look at the name of a plan and you see the letters HMO after it, that means Health Maintenance Organization. And in those plans, you have to use their providers. You have to use their doctors and their hospitals. If it says HMO-POS, POS stands for point of service. That means that your primary care physician can refer you out of network. And if the plan says PPO after its name, that's Preferred Provider Organization. That means typically their provider network is larger and you can go out of network. However, you may have to pay a little bit more. So you want to pay attention to all those things. Most of these Medicare Advantage plans have some kind of fitness benefit. They're all including telehealth. Some give you money that you can spend, give you a certain amount that you can expend on over-the-counter medications and other things at a drugstore. Most of them provide some dental, hearing, and vision coverage. However, the coverage can be minimal, but some of the plans also allow you to purchase like an extra package. So you might be able to purchase an extra coverage for more comprehensive coverage for maybe $27 up to about $45 a month. So be aware that some plans do offer those extra benefits. In addition to these Medicare Advantage plans, there are what we call 2 Medicare savings plans. And you'll find these on the last page because they don't include drug coverage. These are high deductible plans. They only cover costs once you meet the deductible. What they do is they deposit money into an account for you each year, and you can use that money to pay for your healthcare costs. Only Part A and B covered services count towards the deductible, though. You can use that money to cover other services, but towards your deductible, it's only Part A and B services. You cannot be charged more than the Medicare approved amount from providers if you have one of these plans. As I said, the plan will cover all costs after you reach the deductible, but if you have money left in your account at the end of the year, that will transfer to the next year. There are also what we call special needs plans in Medicare. We did not do a chart on these. These plans are different. Some cover people with chronic conditions such as heart disease, diabetes. Others cover people in nursing homes. And some are only for people who we call duals. And that means those people who have both Medicare and Medicaid. Some of these plans have premiums. Some have medical and drug deductibles. The benefits vary significantly and should be compared to all other choices. So if you're contacted by a company about getting a special needs plan, you really want to look at all the services that are covered. And if you're a person that's a dual eligible on both Medicare and Medicaid, and you are on a Mycare Ohio plan for Medicaid, you want to be very careful in selecting a special needs plan because it may not cover all the services that you get through your Mycare Ohio plan if you're with that plan for both Medicare and Medicaid. In Ohio, I just mentioned these Mycare Ohio plans. These are plans for people who have both Medicare and Medicaid and don't have another third-party insurance. These individuals must select, in our region, either CareSource or United for their Medicaid plan. However, they can choose to have their Medicare coverage just like anybody else. So they can choose to have their Medicare coverage through a Medicare Advantage plan, through a special, including a special needs plan, or through traditional Medicare. But they can also choose to combine their Medicaid and Medicare coverage with CareSource or United, and that's called opting in. If these individuals do opt in, meaning they have both their Medicare and Medicaid under either CareSource or United, they do get some extra benefits. They get extra vision benefits. They often get extra transportation benefits. But again, when comparing coverage with other forms of Medicare, individuals who are dual should be very careful in selecting what type of coverage they choose. So when you're looking at Medicare Advantage plans, again, just like Part D, you want to look at cost, and you want to focus on the services that you know you're going to use. So if you know you're going to go into the hospital for a knee replacement, you want to look at the service that you want to look at the cost you're going to incur when you go to the hospital and then later go to a rehab center. You also want to make sure that all your prescriptions are covered under the plan's formulary, that your doctor is part of that plan or accepts that plan. Your doctors, your hospitals. You want to, the Medicare website allows you to compare up to 3 plans side by side. So you can kind of look at the subtle differences between coverage. You also want to look at the star ratings. So on those Medicare Advantage plan charts, I neglected to mention, we have the star ratings, 5 being the highest, 1 being the lowest. I always recommend that you not choose any kind of plan that has a star rating below 3.0. We're very fortunate in our 4 counties that we cover. We have several 5-star plans. And if a plan is 5-star, they can actually accept enrollment all year long. So you can change to a 5-star plan whenever you like during the course of the year. And then you want to look at plan reputation. And I don't mean just what your neighbor's telling you. Just because your neighbor says, hey, I'm in XYZ plan and it's the best plan, that's what you should join. No, you need to look at the services that you use. An example of that would be if you go to a lot of specialists. Most of the plans, if you go to your primary care physician, you're either going to pay $0 for that visit or maybe $5 or $10. But if you go to a specialist, you can pay upwards of $45 a visit or more. So you want to look at those services, and you want to talk to your doctor's office and ask them, which, do you take this plan and are they easy to work with? Because they know how quickly they get paid by the plan. They know how many denials the plan can give for services, so they can give you information also. So here again, to choose a Medicare Advantage plan, you've got to conduct an analysis. As I mentioned, costs for prescriptions especially vary significantly between these plans. You can go online, you can call OSHIP, and they will help you again, or you can call Medicare and receive assistance in selecting. Choose wisely. Remember, you can only switch plans during certain times of the year. Now's the time to really decide what you think the best coverage for you should be. Again, you can switch some of your coverage between January and March of each year. You can change Medicare Advantage plans. You can move from Medicare Advantage to traditional Medicare, but you cannot move from traditional Medicare to Medicare Advantage. If you have both Medicare and Medicaid, you are a little bit different. You are permitted to switch plans once per quarter for the first 3 quarters of the year. So you can switch plans once every 3 months for the first 9 months of the year. I'm going to talk about a few changes and some legislative things that have come up with Medicare. This year, we saw a 2-year demonstration project go into effect for people who need insulin. So some of the plans offered stable, predictable copays of insulin for $35. That will, if you're a person that takes insulin, that will show up when you conduct an analysis. So some of the plans have this, and that's really important because insulin costs were rising very, very quickly. Also, persons with end-stage renal disease are now permitted to enroll in Medicare Advantage, and before this year, they were not. There is also, if you're interested in, and you need to join Part B, there is now an online application to join Part B, which you can find on the Social Security website. We have several 5-star plans, Medicare Advantage plans, which is great. When I compared the premiums from this year and next year, they remain stable. There were some increases in out-of-pocket maximums. There are low copays in all the plans for visits to primary care physicians. So they want you to go see your primary care physician and get your preventive services. Many of them have added telehealth. And then in Summit County, we saw one new plan, and that is with Molina. Changes related to COVID-19. If you get a COVID test, you will not pay a copay. It is covered in full under Part B. Medicare Advantage plans can waive or reduce cost sharing for all types of COVID treatments. That doesn't mean they will, but they can. So they can reduce your out-of-pocket costs for treatments. They have to cover if a person has COVID. Medicare Advantage plans have to cover them if they are out of network, and they cannot charge them more. So if somebody gets COVID and they have to go out of network for treatment, let's say they're traveling or they're in another county, the Medicare Advantage plan must cover that treatment and not charge more. And then I mentioned before, under traditional Medicare, that 3-day hospital stay before going into a rehab center has been waived during this health emergency. And vaccines and boosters are covered in full with no copays and no deductible. Each year, the Medicare trustees release a report about Medicare. And what they said this year is that the hospital trust fund, which is the Part A trust fund, will remain solvent until 2026. We were all a little concerned that because many people were unemployed during this time period, that it would have affected the solvency. It did not. Solvency was improved by 9 years because of the Affordable Care Act. And so we found no effect from COVID. Parts B and D remain financed indefinitely because payments come from the General Revenue Fund at 75%. And then there is a premium that we all pay, and that's 25%. So that will remain okay. Health and Human Services released a report this year, and they were asked to look at prescription drug costs because, as we all know, the cost of prescription drugs in this country is increasing. What they did in their report was they suggested that there be a cap on prescription drug costs and that be legislated. We did see House Resolution 3 passed last year. It passed in the House, not in the Senate. It has been reintroduced. The Build Back Together budget sought to add dental, vision, and hearing benefits to traditional Medicare and lower the eligibility age. And parts of the bill have gone through the House and Senate. I have not heard whether those remained, so that's yet to be seen. A Medicare for All Act was introduced that would provide national health insurance for not only people over age 65, but for everyone. That's going nowhere. But there was a Medicare sequester relief bill signed. And what this did, it eliminated a 2% across the board cut to Medicare payments. So providers were to get a 2% cut in payments, and this was eliminated and signed by the president. News and Social Security. If you're receiving a Social Security check, you've got good news. You're getting a 5.9% increase. And that amounts to about $92 a month for the average person. It's the largest increase since 1983. Usually the increases are about 1.7% annually. You will see some reduction in that increase due to expected increases in Part B premiums. So if you are getting Social Security check, your Part B premium is taken out of your Social Security check. So that $92 might, if it's a $10 increase, that $92 will be reduced to $82. The 2021 Annual Social Security Trustees Report indicated that if there is no legislative action taken regarding Social Security, there will be a shortfall of funds in 2033. So keep an eye on what your legislators are doing or not doing for that matter. The maximum payroll tax for Medicare will increase. So this year, if a person made over $142,000, their payment into Medicare was capped. Next year, that will be capped if they make $147,000 or more. And with that, I will be happy to take any questions.
Yeah, so we've got one question in so far. Again, we will take those through the chat window. So if you don't have your chat window open, go ahead and please do that. That is located in the strip of menu options, either at the top or bottom of your computer or tablet screen. You may have to move your cursor to make that viewable, but go ahead and pop that open. The one question we have so far is there any reason not to use a certified independent agent to explore plans?
No, if you know a certified independent agent, there's nothing wrong with using that person.
And I will share our website quickly as people may be gathering their thoughts here for questions. So our website, is everybody able to see our website? Direction home, we focus on the person, not the problem. When you go to that www.dhad.org, this will take you to our home screen. And again, feel free to explore anything on here. It talks about our various care services that we have available, those free in-home assessments that we mentioned done by a registered nurse, our elder rights department, which is where our long-term care ombudsman's department is housed. But if you would like to look at the Medicare information that Francine was talking about, once you are on our home page, if you go over to resources and education, this blue box here, and you'll see that drop-down list automatically populate. If you go down to Medicare education and click on that, that will take you to this page here that talks all about what Francine just reviewed and how to get into those Medicare seminars. We do have 2 more available. So as you scroll down, it talks a little bit about what these seminars include. This is our schedule here. So you can see the 2 that are left. We have one this Friday and then next Wednesday, and a button to register if you would like. Everyone here with us today should have received an email with those supplemental materials. So the slides that Francine just went through, along with the Medigap materials, the extra help, and then another packet with those county advantage plans. But if you did not yet get the email and you've not yet received the hard copies, if you requested those were mailed out last week. You can go to our website and get those electronically, and all of that is listed here. We have a page with frequently asked questions, the slides, and that is what Francine just shared with us here, the advantage plans, those extra help, Part D, Medigap, all of those are listed here, along with some various other resources as well. HEAP, if you are someone or you know someone who may need help with energy assistance, women in heart disease. And then if you would like to have that Part D analysis done, here is the website for the Ohio Senior Health Insurance Information Program, or the SHIP program, or their phone number. So all of that is again listed on our website. We do encourage you to visit that as often as you would like. Or if you would like to attend one of these last two seminars, we understand that this is a lot of information to take care of in a pretty short amount of time. So if you would like to attend another one, please do so. Again, there's where you would register. I will also have a recording of this particular presentation up on our website as well, and that will be the link here. So you can review that if you wish as well. Francine, we did get another question. It says, my husband is 65, but will not retire until the end of January of next year, 2022. He just applied for Medicare Part B to start February 1st. She is 4 years younger, but she is the one with the chronic condition. Is there any reason to look at plans that will serve me as well as him? Any plans better for travel domestically or internationally?
Okay. If you qualify for Medicare, then you need to look at your coverage separately from your spouse's, especially if you have chronic conditions and your prescriptions are going to be different from his. Medicare Advantage plans have to cover you in the event of an emergency. Some do provide national coverage. You would contact the plan to find out if that is the case. Internationally, you would not typically be covered by a Medicare Advantage plan. If you have if you choose to go with traditional Medicare and purchase a supplemental plan, there are plans that do cover some foreign travel.
Okay. Does anybody have any other questions at all? We are more than happy to answer. I will drop both Francine and my contact information into the chat window again, so you can reach out to us if you think of any questions after we log off here today. Please do feel free to reach out. We are more than happy to help with anything we can. Visit our website, attend another seminar, share this information with your friends. If not, if there are no other questions, thank you for joining us here today.
You.
We know how busy everybody is.
We hope to see you in person next year.
Yes, fingers crossed. Yeah, so thank you, everybody. See you next year, if not before.
Bye-bye.
Bye, all. I'll hang in just in case there are any questions. Francine, we did get another question.
Okay.
I'll retire at the end of this year and lose my health insurance coverage. I'm currently receiving Social Security. How long do I have to enroll in Part B, and how do I enroll?
So if you're retiring before the end of the year, you want to enroll in Part B now, so that your coverage can begin on January 1st. To enroll in Part B, you can go to the Social Security website. There is an application, or you can go on the Medicare website or call Medicare.
And I do see there's one person here with us on the phone. I know you were not able to see, obviously, the presentation. So again, if you would like to go to our website to review this recording, please do so. That is www.d as in David, HAD as in David.org. Once you're there at the home screen, towards the right, you'll see a few blue boxes. One of them says Resources and Education. When you put your mouse over that Resources and Education block, you'll have a drop-down menu come up. And if you click the Medicare Education, that will take you to the Medicare page. And as you scroll down, you will see a link. It will be up later today. It's not active right now. This is the session that I will be posting. But when you click that to view the recording, you'll be able to see everything we discussed today. Let's see. There are lots of commercials for Advantage Plan. What's the scoop on these sites?
Yes, there are a lot of commercials for Advantage plans. The enrollment in Advantage plans has been growing over many years. Again, you need to do an analysis. Don't go by the commercials. Don't go by all the information you're getting in the mail. Get rid of all that mail and have an analysis done.
If there are no other questions, I'm going to go ahead and end this meeting for everyone. Again, if you come up with any questions that weren't addressed here, and after you've had a moment to digest the information, something pops up, please feel free to either call or email Francine or myself, and we're happy to help. Until
Thank you
then,
again.
yeah,
Bye-bye.
have a great day, everybody. Thank you.
Enjoy the weather.